Initiative, you want to do the roll call, please?
Yes, Chairman. I'll begin. Norman Boyd,
Here.
Roger Folsom. Roger Folsom. Russell Crutchfield,
Present.
Russ Childers. Russ Childers. I see you, Mr. Childers, if you'll unmute yourself.
There we go. I'm here. I'm
Thank you,
sorry.
Mr. Childers. Anthony Williamson,
Here.
Kenneth Davis. Kenneth Davis. David Cruz,
Here.
Nelva Lee,
Here.
Cynthia Rucker,
Here.
and I'll go back to Roger Folsom and Kenneth Davis. Thank you, Chairman. That concludes my roll call.
Thank you, Denisha. We do have a quorum, so I will call our meeting to order. Thank all of you for being a part of our call today as board members and other participants. We welcome you to our program this morning. We have a rather brief agenda, and we will work right through that this morning. We have one item as a board to consider for final adoption in our program, but first we would like to call on our secretary, Russell Crutchfield, concerning the minutes of our November 18 meeting. And Russell, have you read those minutes, and can you recommend that they be approved?
Well, good morning, Mr. Chairman. I have reviewed the board meeting minutes from the November 18th meeting, and I found them to be correct and in order. And I move that we approve the November 18th, 2021 board meeting minutes.
Is there a second to that approval?
Russ Childers seconds.
Mr. Childers has seconded that. All in favor, say aye.
Aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, the minutes are approved. Thank you, Russell. Thank you for that. Next in our program today, Mr. Childers' audit committee met prior to our meeting here today, and I would call on Mr. Childers to give us the board a report on the audit committee meeting.
Well, we did meet today. We reviewed the corrective action plans that were presented by Ms. Smith, the Inspector General, and found them to be in good order. And that would be there. And I don't know if this is attached to the board packet, but there was a summary of the various findings and recommendations for the corrective action plan that was presented to the committee at least. And if anyone would like a copy of that, I'll be glad to provide it if it wasn't in the board packet.
Any questions, comments for Mr. Childers? Hearing none, thank you for that report and for conducting the audit committee meeting this morning. I think you have that set up now on a quarterly schedule.
Yes, sir.
Next on the agenda is a commissioner's report, and I will turn it over to Commissioner Nago.
Good morning, Mr. Chairman, members of the board. Thank you so much. A couple updates for you this morning. Previously, we mentioned to you that we were pursuing an additional or expanded scope of work for one of our audit firms to engage in some CMO contract compliance. Happy to report we have finalized that scope of work, and that project team is working on a 90-day plan, and we'll have some outcomes and some output from that work probably within early springtime that we'll be able to start sharing with you. So happy about that. I have also mentioned to you kind of as I have focused on quality, both in our outcomes and benefits, but also internally in our service delivery and operations, that we've engaged the Carl Vinson Institute to help us look at some of those efforts. We've kicked off that project. We've had a couple of meetings with them and are working to establish what we feel like will be meaningful key performance indicators for the agency, and how we elevate a few of those to prioritize those to start moving things through the agency and improve some functions there. We'll continue to keep you updated on that work as well. You may recall back in June, the board voted to approve final adoption of the renewal of the Comprehensive Supports Waiver Program in partnership with DBHDD. After further dialogue and feedback with both DBHDD and CMS, we've resubmitted the comp waiver without any changes to the service levels that were previously contemplated. No additional actions necessary at this time by the board, but just felt it appropriate to keep you updated, and we'll continue to keep you updated as that renewal process continues. I know many of you are aware, and I know many of our constituents are aware of an ongoing contract negotiation between one of the SHBP's planned administrators, Anthem and Northside in the area. That remains a negotiation between two private entities, but DCH is monitoring that situation. My hope and my expectation is that both of those parties will continue to communicate and work towards a resolution. We're also working within SHBP to make sure that our members that are eligible for continuity of care benefits are notified, and that other timely communications are provided to the nearly 30 to 34,000 potentially impacted SHBP members. And we'll keep the board and the public as well updated as we learn of any developments there. Earlier this week, I believe on Wednesday, CMS issued new guidance to the state that would require us to cover treatment associated with clinical trials effective January 1, which is a very short time frame. I think Lynette Rhodes, our director in the medical assistance programs, is reaching out for some further details. We're doing a little bit of internal analysis, but just wanted to make the board aware that may be coming very soon, and that would need to go out for public comment. So we may be asking the board to meet again later this month if that in fact is the case, that we need to go down that route pretty quickly. Finally, I just a thank you and a shout out. There's been a work group that's been meeting for the last year or so on how we serve youth in psychiatric residential treatment facilities, including some advocates of the Voices for Georgia Children's Group, the Georgia Alliance of Therapeutic Services, which includes the 6 PRTF facilities in the state, as well as all of our managed care partners, Peach State, CareSource, and AmeriGroup. And I'm super happy to report that as of this morning, we can now say that within the managed care program, we have a standardized initial length of stay authorization for any admission into a PRTF of 30 days. Just want to extend my appreciation and sincere thanks to both all the managed care organizations as well as our partners that have been participating in that group. We certainly have more work to do in that area, but this is a really, really big, significant first step for us. And finally, as I always like to do, just want to recognize some employee milestones that we're celebrating this month. Danielle Parker Umrani, Lamaya King, Melanie Reed, and Michelle Henderson are all celebrating 5 years with the agency. Forrest Dahmer is celebrating a 10-year working anniversary, and Vivian Denson out of my office is celebrating a 20-year anniversary with the state. And this time of severe workforce shortages and severe competition in hiring, we can't thank those folks enough for being committed and valuable members of our team. So thank you. And finally, just happy holidays, sir, to you and to the board. It's been such a pleasure getting to know and to work with all of y'all, and I look forward to continuing it into the new year.
Thank you, Commissioner, and we'll certainly be available to you, I'm sure, to assist if we need to have a special call or something later in the month. So are there questions or comments for the Commissioner from the board, please? Hearing none, thank you again, and we will move into the one item we have on our agenda today to consider for final adoption. It has to do with rules and regulations for the nursing homes. All of us have been provided materials for this in advance, and Brian Peterson, attorney in Healthcare Facility Regulation Division, will make the presentation. So Brian, please proceed.
Good morning, Mr. Chairman Boyd, Commissioner Noggle, and members of the board. The Division of Healthcare Facility Regulation presents rules for final adoption for nursing homes. These rules are found in Chapter 111-856 of the Department's Rules and Regulations. The revisions of the nursing home rules are necessary for the department so that the nursing home rules comply with State Bill 215, a bill entitled An Act to Amend Article 1 of Chapter 7 of Title 31 of the Official Code of Georgia Annotated. And this bill pertains to regulation of hospitals and related institutions, including nursing homes. An opportunity for public comment was held on Tuesday, November 16th, 2021 at 10 a.m. via WebEx audio. Additionally, written comments on the proposed changes to the nursing home rules were due to the department on or before Friday, November 19th, 2021. The department did not receive any verbal comments during the public hearing. Additionally, the department did not receive any written comments that were submitted to the department in response to the proposed revision of the nursing home rules and regulations. At this time, the department is requesting consideration for final adoption today.
Thank you, Brian. Any comments, questions from the board? Hearing none, is there a motion for approval for final adoption?
I'll make a motion to approve.
Motion has been made for approval for final adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion for approval for final adoption. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved, Brian, and thank you very much.
Thank you, Chairman.
At this time, and again, I want to thank the department and Brian in particular, always providing the board in advance the materials for consideration, and we have an opportunity to review those. Does anyone on the board know of any new business that needs to come before the board at this time? Or anyone have any comments they'd like to make? Hearing none, I will add my wishes to all of you for a very Merry Christmas and a Happy New Year. I can't believe we're going through this again so fast. It seems like we just had the holidays a year ago. Time is moving on. So we'll look forward to 2022 when we meet the next time. And thank you all so much. And with that, the meeting is adjourned. Thank you.
Thank you.
Holidays.
Yeah.